Hi, this is Tom Maxson, LMBT at Bodywork Therapy Seminars. I've been working on some new classes, new content, because I'm new here to this area. I've taught some of this stuff in Florida a couple times, but now that I'm part of the Bodywork Therapy Seminars team, I really got to kind of up my game a little bit, honestly. I'm doing some deeper research into the topics that I'm teaching, and I just keep finding more and more exciting information that I want to pack into these classes. So I want to answer today a couple of questions that I've been getting from people who don't know me because I'm new. What is this class, Zoned Out Reflexology, about? Zoned Out Foot Reflexology. It's kind of a play on words a little bit. Zone reflexology and the concept of being zoned out mentally. Reflexology has been proven with several studies now, good, reputable, peer-reviewed journal articles about the benefits of reflexology for improved sleep and for anxiety, symptoms of anxiety. And anxiety is one of the biggest issues facing our mental health in this country right now. It's a very expensive problem, and so far, most of the treatment has been pharmaceutical, and if the pharmaceuticals don't work for that patient, they're kind of out of luck. There are not a lot of other well-studied options, which is where reflexology is a really good option. It's pretty much harmless as far as side effects. The thing that might happen is you might sleep better. So you're going to get 2 for 1 there. You're going to have lower anxiety and better sleep. Almost anybody, even to the latest stages of hospice care, palliative care, can handle and receive benefits from foot reflexology. And that's been shown. So there's pretty much a huge range of people who can really benefit from this technique, from this information. And I'm going to share that. That's what the class is about in terms of mental health and being zoned out, that terminology. How can we help our clients really deeply relax without taking the time that it would take for them to learn a bunch of breathing exercises or progressive relaxation meditation or full body Swedish massage. Takes a lot more time to get down to that core brainwave state of deep relaxation. And this zone reflexology technique is really good to get us there in a fast, effective way where it's not hard on the therapist to do the work. So all of my classes are all about how can you be the laziest you can be and the most effective at the same time. So if you could be safe with your body, not hurt your thumbs. I know a lot of people have expressed that they don't like reflexology as a technique that they do, that they would provide as a therapist because it's really thumb intensive, or they've had classes where they hurt themselves. You know, they left the weekend seminar and they couldn't, feel their hands. Everything was sore and tight and grumpy. And that's the opposite of what I learned in my 300 plus hours of reflexology training. You've got to be nice to the feet. You've got to respect what the client's body is telling you, the feedback that you're getting from the markers on the feet. So we're going to talk about that. How can you take some of those cues that you're getting from the body of your person on the table and use that information in a positive way without hurting yourself and without trying to muscle through something. The feet are phenomenal. They can take a tremendous amount of pressure and impact. If you run a mile, 1 mile, you will absorb more than 1 million pounds of impacting pressure on your body through the feet. Each foot will take 1 million pounds. And that's insane. How can we as therapists compete with that kind of pressure? we can't, I can't push 1,000,000 pounds of pressure through my thumb, tiny little thumb, into somebody's foot. So we've got to work smarter than that. We've got to find another workaround, another way to get the attention of the body without just pounding on their feet all day. So there's a lot of really powerful information that we're going to cover, and I'm excited about it, and because we can get such well-found results without hurting ourselves. And reflexology as a modality can be huge. Like I said, I've taken almost 400 hours. I still want to learn more. There's constantly information out there. There's books. There's new studies coming out all the time about how the nervous system interacts with the fascial system and the musculoskeletal system. And the feet are just full of that kind of tissue that is all in constant communication with the brain. So there's layers and layers and layers of information to pick apart, which is why in this class we're going to focus on 2 of those: mental health issues and how relaxation and sleep are going to benefit the body of our client. And it's going to be kind of a bite-sized way so we can give some good examples to the client and speak to them at their level, because nobody wants to hear about nerdy neuroscience all day when they're not sleeping well already, or they're anxious about everything mentally. They don't have time to talk to us about neuroscience and brain chemistry. So we need to be able to communicate that well as reflexologists, as therapists, as massage therapists, as licensed manual therapists. We need to be able to talk to people in a way that they are going to understand and benefit from the information. Because if we just throw a textbook at them, nobody's going to care. It's not going to go inside their head and make any good positive change in their body. So please comment or ask questions, give us a call. I'm going to put links to register for the upcoming class. I have several more over the next few months. And this has been about zoned out foot reflexology, taught by me, Tom Maxson, LMBT, here at Bodywork Therapy Seminars in Cary, North Carolina. Thank you for listening.